New South Wales recorded 1,405 locally acquired cases of COVID in the 24-hour period, 2 overseas cases, and we had 156,481 tests. So thank you to all of those people who presented for testing, but also those involved in taking those swabs and undertaking that testing. We currently have 202 cases in ICU, and they span the age range. But a key feature is the predominance of people in ICU who are not vaccinated. So as our ICU and our emergency department colleagues have mentioned at previous press conferences, please come forward, get vaccinated. We do not want to see you or your loved ones in ICU. In terms of deaths, tragically we've had 5 deaths, and I want to express my condolences to the families. We've got a gentleman in his 80s from northwestern Sydney, died at Nepean Hospital, and he was a resident of the aged care facility in Penrith. This was the first death associated with this outbreak. He had received 2 doses of the COVID vaccine but had serious underlying health conditions. There was a woman in her 70s from Western Sydney, died at Ryde Hospital. She was not vaccinated and also had serious underlying health conditions. A woman in her 70s from Western Sydney died at Concord. She was not vaccinated and also had underlying health conditions. A man in his 80s from Sydney Local Health District died at Westmead Hospital. Again, this gentleman was not vaccinated and had serious underlying health conditions. And a woman in her 40s from southwestern Sydney died at Liverpool Hospital. Again, she was not vaccinated and had serious underlying health conditions. In terms of the risk, we are seeing the case numbers continue in those areas that we've previously talked about. So that Cumberland LGA, that Canterbury Bankstown LGA, Liverpool LGAs. But what we're also seeing is the fact that we're seeing an upswing in cases in the inner west, Glebe, Waterloo. And so I just want Matraville, just to call out to the communities in those areas. You may not have perceived yourself at risk, so please get tested if you have the most minimal of symptoms, but also book your appointment for vaccine. Over the coming weeks, the supply to general practice is increasing as the Commonwealth have procured and brought forward doses of vaccine. Please ensure that you continually check and get an appointment and get vaccinated as soon as possible. In terms of Central Coast and Wollongong, we are seeing an increase of cases in those 2 areas, and again a big call out to our Wollongong and Shell Harbour communities. Please get tested, but also take the opportunity to get vaccinated. And also our Central Coast residents, please be very vigilant and also take up any opportunity to get vaccinated. Thank you.